on April 25th. I'm Kin Kinney, the Coalition Relations Director at USBC, and I'm so glad to be hosting this call with your group. So I am here with my colleague Miriam Rodriguez, and I'm going to turn it over to Miriam.
Hi everyone, this is Miriam. I am the USBC's Coalition Relations Coordinator, and I wanted to welcome you all to this call today. We're really happy that you can make it. So we just wanted to go over a couple of meeting logistics before we got started. Please make sure that your audio tab is set to the method you're using. A lot of people, if they experience computer issues, the phone is sometimes better for a more stable connection. And if you can all mute when you're not speaking, that would also help us be able to listen to you all. And if there is a chat box available, if you're on the phone or if you want to share something and maybe not unmute your line, feel free to use that. If you have not used your system before, our control panel for GoToMeetings is going to be on the right-hand side of your screen. You can pull it out if it's minimized using the orange arrow, and you can unmute clicking the microphone. If it's green, you're able to speak, and if it's red, that means you're muted. The chat box has the little symbol, and you can dock and undock whenever you need. And I already mentioned that. So as we all know, the meeting objectives are to connect with each other and to, with our work that we do together, share updates and resources to resurface specific TA needs. And our standing meeting times are last Thursdays of even months from 1 to 2 Eastern. Thank you for joining us. So if we can go around introducing ourselves with our name, organization, or coalition, we can start with just the order of the names on the doc. So if we wanted to start with Betsy. Hi, Betsy.
Hi, everybody. This is Betsy Dantasak. I'm with the Louisiana Breastfeeding Coalition and also work with the breastfeeding program at the Bureau of Family Health in Louisiana.
Welcome.
Welcome, Betsy.
I think next is Christine.
Yes, hello. I'm Christine Sassy from Arkansas. I'm the WIC State Breastfeeding Coordinator and work on the Arkansas Breastfeeding Coalition and our task force and many ASPHN activities. So happy to be here today.
Hi, happy to have you. Jacqueline?
This is Jacqueline Bondi. I'm the State of Nevada Breastfeeding Coordinator based in the WIC program.
Hey, I think Kelly's next. Kelly, are you with us? Let's see, chat box. Hello, Kelly with Wisconsin Department.
She chatted.
Yeah.
I was going to say.
Awesome. Thanks.
Welcome, Kelly.
Welcome. Hi, Sandy. How are you?
I'm good. I am next. I'm Sandy Perkins from ASPHN.
And Michaela?
Hi, this is Michaela Schlosser. I'm with the North Dakota Department of Health and work as a maternal and child health nutritionist.
Welcome. I think Bruce is next.
Samaje, that's my first name. Hi, I'm the breastfeeding program coordinator here with the Las Vegas Urban League WIC office.
Welcome. And Suzanne?
Hi, this is Suzanne Haydu, and I'm the Nutrition and Physical Activity Coordinator for Maternal, Child, and Adolescent Health, which is Title V in California.
Welcome. Is there anybody that we missed? I think I see Rosemary.
This is Jacqueline. She wasn't able to join us today.
Oh, okay.
Sorry, I'm driving in my car and I just signed on for my phone.
Oh, you did? Okay, sorry, Rosemary.
That's okay.
Welcome. Is there anyone else on the phone?
Yeah, this is Marcy Brewer, Louisiana Department of Health. I'm on the phone and I'll be hopping on my computer in a few moments.
Great, thank you. Welcome.
Anyone else? Okay. Well, welcome. So I wanted to share a few USBC updates at the top, and then we'll open it up for state updates. You all did an amazing job at the webinar. I couldn't join you live at the webinar, but I heard the recording, so all of the updates were great. So if we want to use this time to, surface any TA possibilities that you need as you wrap up your breastfeeding work, or talk about any of your I&I work plans as you're doing, that might help too. So I did get a few, early feeding sample questions and things that I'd like to share with you as well. So are there any questions at this time before I start with the USBC updates? Okay. So our National Breastfeeding Conference is June 14th and 15th in Bethesda. So we hope to see many of you over there. I wanted to know if, Nevada, Louisiana, Arkansas, if you're on, are you planning to come to the conference this time? There's a, coalition-sponsored attendee thing. Is Nevada coming?
Yes, I will be representing Nevada. This is Rosemary Casillas.
Wonderful. Well, is North Dakota is not on the call today, right? So I don't think we have anyone from North Dakota today.
Yeah, I'm here.
Oh, Michaela, you're there. Of course,
yeah.
Michaela, of course you're on. I minimized my panel. I'm completely spaced out. So will anyone be coming from your state, Michaela?
Yeah, we have two, I think 4 people going actually. So 2 are presenting about work they did through their local public health unit, and then 2 were awarded the Tribal Trailblazer scholarships.
Oh, wonderful. Okay, that's great. So we know that the tickets and things have to be booked by the 30th. So we by the 30th of April, because after that they get a little expensive. So, and we are wanting to keep within our budget. So we wanted to make sure that if any members hasn't made their bookings yet, that we support you. So that's great to hear. And Louisiana, is anyone coming, Marcy?
Yeah, so I'm going to be coming. Can you hear me okay? Kenny,
yes,
my
Marcy.
phone's being
yes.
a little weird. Okay, sorry. Yeah, I'm planning on coming, and then Mackie Robertson, who heads up our Black Mothers Breastfeeding Club of Shreveport Bossier, and who's engaged in the coalition and a lot of other work. She's going to be coming along as well. And yeah, I just waiting on travel authorization, but should be able to do our registration tomorrow.
Awesome. Thank you. That's great to hear.
Sorry for the delay.
No. We know how long some of your state approvals take. So Camila's going to be really happy. We have a very, very good program this time, and just amazing proposals. So from this state, so great representation, good speakers. So it should be a good event. So thanks for that. Moving on, some of you might have received emails. So this is a workplace summit that's going to happen on the 6th of August. It's a day-long summit that's been funded by the Kellogg Foundation and being hosted by the Center for Workplace Law, the ones that has been doing a lot of really seminal work. So they are doing a one-day summit. There's something on the 5th. as well. So basically, it's an invite-only summit, small group. They hope to have about 30 or 40 people in there, and what they had asked USPC to help with is to see if there are. The purpose of the summit is to get together some experts who are working on state level legislation or any kind of workplace issues and talk about, have legal experts there, have campaign experts there, that if you're going to do something either with a big P, which is state level legislation or something, or a small P, it could be like a policy at your school district, something on a smaller scale, whether it's that, to have states who have either done something or who are ready to be, are looking for support, assistance, time with legal experts who have done this work to come in and do some, deep work for that day. How do you get ahead and get going on the plans that you're making? So pretty much every state team in the Children's Healthy Weight CoIIN that's working on workplace accommodation, I've recommended that you be invited to this summit. So you will probably, if you haven't already gotten an invite, you should be getting an invite. And I really hope that you can, if you can make use of that. They will pay for your travel expenses, being at the summit, and it's going to be a really rich day of, and it's not just the summit. So basically the folks who go there and get started on any kind of workplace support thing, you'll have the support of the expert team following you and helping you in your workplace accommodation efforts post-summit as well. So any questions about that? Is there interest in this group? I shared your information. I'm going to be, Cheryl and I will be at that summit as well. It's easy that it's in my backyard in San Francisco, but we really want to make sure we are connecting the states who are doing this work with the folks at the foundation and the folks with Center for Work-Life Law. And yeah, go ahead.
Sorry, this is Jackie. So did you just say that the accommodation would be included as well?
Yes, so they will be, the Kellogg Foundation is funding this summit. So to be able to come there, they will be covering the expenses of one rep, I think, from each state that can be there. So mostly we are looking at folks who are already doing some work, wanting to take it further, are involved in it more than folks who are in an exploratory state. So contact me if you haven't got an invite in the next week or so. Would you let me know, and I'll work with Liz to make sure that that we are reaching out. So USPC's role in this is in support mostly. Our Cheryl Lebedev, which is our workplace support steward, so she'll be helping with some of the content and all of that. But I'm doing the dot connecting here. I'll be helping with some of the workshops and presentations as well, but mostly just making sure that as we hear from states who are doing this work, that folks who would most benefit. And we've recommended North Dakota as well, because one of the things that Michaela, when we spoke with you and with Jacob as well, is that there isn't a lot of case law for how you do workplace accommodation in tribal work sites and native work sites. So having and there is no national. So even our folks at ACLU and the work-life law haven't done a lot of work on tribal workplaces. So just having that angle over there will galvanize them to get resources and kind of think about that. So I hope someone from North Dakota can be there.
Thanks, Kinkini. I was actually going to ask, since our CoIIN work didn't directly relate to workplace, if we were included. So yeah, I'll
Yes.
be watching for that.
Yeah, Arkansas, definitely, Christine. So, and for those who are in the, at the TA level or and wanting to do this, please just let me know, because what we want to make sure is that any of the support and groups that states are getting, that we are able to disseminate that, bring some of that to a wider audience as well. So for those who will be there in person, yes, for those who may not, and if you're working on something, let us know so we can see if there are spaces there that we can get you into this summit. Okay. Next one is that we will be for the past few years, and those of you who are member reps like Suzanne and others know that there have been national constellations where in workplace support and lactation providers and things. So we will be starting some of these very similar to the constellation, but state level, where we are working on state levels for change. So we'll be starting a bunch of learning communities this summer. And so early childhood education, childcare and education will be one of them. Emergency preparedness would be some, maternity care practices, continuity of care. So again, those will be spaces where our national experts and the state folks will be coming together and looking at what could we be doing, who's working on state levels, how can we support you, how can we help you. So these will be topic specific learning communities, very geared towards action and prioritizing. So not just coming and sharing updates, but actually helping the states refine or discern what might be some policy things or legislation things you want to work on. So keep an eye out for those. We are really, as we see more and more states wanting to do nutrition, infant nutrition in the early childcare education realm, we feel that that would be a good place. Again, USPC won't be leading the work on it because we are not specialists in this, but we will be doing the convening and making sure that we bring the folks who are actually doing this work on. So any questions about state learning communities?
So to be clear, Kinkini, the state learning communities, they do not have to be members of the USBC to be part of those communities.
We do. This will be we'll have some learning communities for non-members, but this will be for member organizations to come in and work deeply on policy work.
Okay, so just to be clear, so like for ASPHN, so Association State Public Health Nutritionists, we have 4 people on the USBC as our liaisons.
Yes.
And only those 4 can be on these learning communities, or can other members of ASPHN be on them?
Usually it is the member reps, but I'll speak with Danae and see if you want to spread yourself and kind of join more than one. How do we make that happen? As much as possible, we want our member reps to be engaging in things that they are. So how we are doing that is there was a kind of engagement survey that went out to all of our members and even the new members coalitions that are coming into US membership, saying these are some potential things that we are convening in. Tell us where your engagement level is. Is it peripheral, that it's not much on your radar? Is it something that's core to your organization? Is this something that's related? And based on that, we'll be calling the members and saying, looks to me like you said this was a core. So if ASPHN, for example, has set core on a bunch of things, emergency preparedness, early ECE, and other things. We'll find a way for your reps to be, joining these communities. If it's a coalition that's a member and wanting to be on 5, and you have only 4 reps, we'll make sure that we are scheduling so that more members are able to be part of these. And the because sometimes you might have a member rep, but you might have someone else in your coalition that's doing work on workplace, or that's doing work on maternity care practice. So we also want to make sure that you're sending the most relevant staff to these. So yeah, we can definitely work with that.
Okay, thank you.
Sure. And I know it's a lot of meetings and a lot of different stakeholder groups, but so all we ask is feel free to join if that makes sense to you. Come and try it out, and again, join the ones where you feel that you can get the most bang for what your own mission and organizational priorities are. I see a few folks have joined. Is there anyone new who's joined who hasn't introduced? Hasn't had a chance to introduce yet? Okay, I see Ifeanyi. Okay, awesome. Welcome, Ifeanyi. And then I'm going to turn it over to Miriam to talk about our National Observant Month resources. Miriam, I'll make you a presenter.
Great, thank you, Kinkini. Yeah, so we wanted to share a sneak peek of this page that we've been working on. We have been trying to be very aware of all the different observances of each month, and we have a couple here in our in this new page that we've created to highlight all of these months so that it's easy to find for everyone on our website. And there is one missing, I believe, and so we do have this webinar where we celebrated Asian American Heritage Month. That was in May, and we have all of these resources for you all, and we can share this once it's finalized. There's still a couple of things we have to work on, but it's really exciting that this is going and that we are going to be able to share this on our page shortly.
Thank you, Miriam. So this last year, since 2018, we've really curated resources, a lot that have come from you. So we usually, you can see, we send out an email during one of these months and say, hey, if you all have info, would you share? And so do you want to click on one of these, Miriam, and show what so during these months, for February, during Black History Month, we lifted up a lot of the organization. So part of this is that we curate, but we actually refer folks to the organizations that are really doing this work, to the tools, materials, resources. So these have been really rich pages, and we want to make sure that it's not just during that specific month that it floats on our radar, but something that you can go and download the tools and resources throughout the year. So we've created, with this page, we'll put a button or something right on the home page so people can see, okay, that's where it is. You don't have to go through 5 degrees of clicking to get to where were the Hispanic Heritage Month resources, and where was the Asian API resources. So for each one of these, we had curated from you all the rich resources that are in the field and created a page. But what we are doing is putting them all together so that in one place, so you can find these resources. And again, like I said, it's not just for those months that we lift up the issues, the assets, the strengths, the challenges of these communities. It is year-round, so we are very happy to keep updating these pages with resources. So if you come up with recent ones, you create something new, send it to us. We will highlight your coalition. We will highlight your organization. We will mention it in the weekly wire. We'll mention it on social media, and we'll put it in here so that it's there for the entire network to access. Any questions? Okay, well, thank you, Miriam. I'm gonna make myself the presenter again. And so one of the things that I wanted to ask is, like, whatever makes sense for you in the time that we have, in the 30 minutes that we have, would help. Since you've all given updates on the status of your projects, if this could be more targeted things that you need as you wrap up your breastfeeding projects, or as you think of your integrated nutrition, it's open to that. Some of the resource lists that I had is that the pregnancy to birth, there's been the new American Journal of Clinical Nutrition, latest issue has the systematic review. This one is really, really rich with all of that. As soon as we get, you can read the articles here, but we will share all of the lists of the papers with you as soon as it becomes open source on PubMed. So this is coming up. This is really great as you're thinking about your nutrition drivers. Think about, this is some good stuff there. These are just resources that have crossed our desk. CDC has published a paper on the obesity burden, again, by racial ethnic categories again, and there's more about what programs are currently there. This is about adult obesity, but there's good data in there. WIC changes, this I picked up from the California CW WIC Association flash. So again, really good info about the change since the WIC food packages were put in place. This is a really good webinar coming up from Nature. And then these are some open access articles that are free for access through next week. So I just put those down for you if you want to access those and see. This is a really good blog by Kathleen Kendall Tackett about how, some of the foundational things that some other countries have that the US doesn't have, that allows for the birth and postpartum, health of the mother, and the, initiation and success and support of breastfeeding. These are some, again, articles. This is a blueprint for change, really good. If you can read the Change Lab Solution blueprint, it's a wonderful guide again. And then these are some upcoming webinars that are coming up, that are from Tamarack, all free, no cost. Principles and elements of community-based development, how do we build inclusive communities, community change, all about engaging the community. So very good resources that you can, once you register, they send you the recording. So even if you can't make it for that date, they have you in your system, and you can access the, the details, the slides and the recordings later. So that's our resource list for today. And then I had a chance. Is Anna on the call today from AMCHIP? No. Okay. So in the report that, some of the things that the state teams had shared as we're thinking about nutrition is looking to see what's out there. So is any of you wanting to have some surveys out on early child feeding or child nutrition? Was that a surface need? As you're thinking about your nutrition drivers, wanted to know.
Kenny, I'm just looking at this. Are you saying this has gone to the states to complete the survey?
No. I wanted to say I'm sharing some sample questions. So this is a synergy. So what? So USBC, there's a MCHB fund. There's a different project that is working on early childhood feeding. AMCHIP is taking the lead on it, and a lot of the work is on what's happening with Title V programs, MCH programs, on child feeding, what's the scan, what resources are out there, what are some things that's breastfeeding and child feeding. So it's 0 to 2 mostly, early weaning foods and things. So AMCHIP has been doing the stakeholder, they did a focus group, City Match did a survey of their MCH programs to see what's out there. So some of the questions that they've used are I thought, as you all are thinking about it, if you wanted us to see what some questions are out there, what's happening in your own states through some other grant funded work, you could have a look at this. So this is not anything for you to, for your state to fill out. It was just something that I thought that would be good synergies if folks are looking to see for your nutrition drivers. I think for California, you have a pretty set, you've decided on your nutrition component, right?
Yeah, I was just thinking, oh, this would have been great if someone came to MCH and asked them those questions.
We will, and so the USBC is involved in this project, and what we are doing is working with 5 distinct cultural groups. We are working with Native, so our Cultural Changemaker Award is so Native tribes, Asian American, Latinx, Black coalitions, Black-led coalitions, and looking at what kind of materials are out there for these cultural groups, and breastfeeding and early child feeding, any of that. So doing a little bit of a scan for that, seeing. So we will be using some of these questions, but also including a little bit more on food sovereignty and food justice, and what are some barriers to that communities of color face as well. So we had a bank of questions that I thought, hey, that might be nice if any of you are thinking about nutrition work and you want that. We'd be happy to share. I spoke with my colleagues at AMCHIP who are working on this, and they were like, yeah, please feel free to share, and let's find synergies between this group, because there are a lot of folks who are looking to see what kind of nutrition data there is out there.
And this is Sandy. I want to toss in that ASPHN is also discussing working with AMCHIP on this project as well.
Wonderful. I know that Anna will be joining. The folks at AMCHIP have been talking to each other, so this is very exciting.
Yeah.
Okay, So those were some, and I'll send you these questions for the groups that had said, hey, we are looking for anything you can find on nutrition as you're trying to refine what your projects are and decide on your projects. But in terms of state updates, what would you like to discuss today? What would you possibly, you know, we do individual TAs as well. So if you need to schedule time with members of the USBC staff or the Children's Healthy Weight Steering Committee folks, happy to help you as you write up your breastfeeding reports. Yeah, we calling on the states to see how things are going and what you need, or what you, or if you won't need to set up appointments with us. Anything from Louisiana, Betsy and Marcy?
I would say one, I don't know, one super positive thing is after the last call when we had the DOL folks on there, and then received, contact information for our local person. We reached out and he's going to come to our next statewide work group meeting. And so we've made some contact there. So that was really, fruitful, very helpful, and we appreciate you guys making that connection.
Oh, that's great to hear. Arkansas, are you looking, how are things going with your group?
Yes, this is Christine. We are, what we're looking at is to proceed looking a little bit more toward the faith-based community of pulling them in, and we're looking at ways that we can make that applicable to WIC. Since as a member, I am working under a little bit more tight guidelines of how to make sure that I am working with those potential WIC clients. So we're looking at, a lot of our WIC clients we realize are not necessarily attending church, but perhaps their parents and grandparents are. So we're going to see how we can make that fit and expand on the business and the early child care room and education efforts that we've been doing. So we're looking at that. Kenya, the lead, and myself will be presenting at our statewide breastfeeding symposium on work site and early child care, what we've done and what is recommended, trying to get others motivated. So that's upcoming. We're also, this is a little bit kind of draft ideas, but looking at going out and maybe even doing a little bit of interviewing and even some videoing of what early child care centers have done and some testimonials that we could use in our messaging. So that's pretty much where we're at of looking forward and just trying to see how and where we all still fit as team members and what we can still bring to that team moving forward.
Oh, fabulous. And so the one thing that, when I said that we would be looking at starting some learning communities with ECE is that CDC is going to be doing a special webinar on breastfeeding, early feeding in the ECE domain. So Christine, I'll make sure that Arkansas, any of the groups that are on that you all receive those. I think that webinar is going to be sometime in June or July. Sandy, what is the timeline for our team groups to be kind of finalizing their nutrition thing.
Nutrition or breastfeeding?
The nutrition, the I&I part.
I&I is not set yet on the deadline. It will continue on in the extension year if we receive that funding.
Awesome.
Breastfeeding is August 31st.
Yes, yes. I'm so for those of you who will be doing like working for your I&I on the ECE and things, I'll make sure that we get you on the learning communities if you'd like, and also be part of that. Like send notices to all of our things about the webinar and the ECE feeding that's going to happen there.
Yes, definitely, and we are our state is breastfeeding, but I actually had sent in the chat box to you that I was personally interested in that ECE learning community information, so that would be wonderful.
Okay, Kristen, will do. Thank you. And then California, Ifingwa, Suzanne, if you can, if you want to share. I know we're looking forward to that brief.
Yeah, so you want an update of where we're at? Is that what you're trying to get now?
Yeah, anything that you need update or, support you need or anything you want to share with the group resource?
No, that it is the there was a brief that was done, I don't know, 10 years ago on lactation accommodation for the low-wage work group and workers, sorry, and it was done by California WIC Association. So Athena's intern is actually kind of taking the lead and redoing that, and we just had a meeting to kind of finalize it, but it seems like we only got through like 1.5 pages. We just are big editors. So the other thing is that we're working on is we have our comprehensive perinatal services program, which is about, I don't know, 1,600 providers in the state. And we're trying to do a 5-minute training on lactation accommodation. So we're working with our contractor to develop that. So that's a new piece. But I'm not sure what we need technical assistance on right now. Benoit, can you think of something? I don't know if she can speak. Yeah, and I know that the California WIC conference is next week, and they're having presenters on the topic. So okay. It seems like this whole thing kind of blossoms. We're doing a million things.
Yeah. So the offer that's open is any technical assistance you need or an opportunity. We'd love to, even if it's not complete, but we always highlight the states in USBC webinars. So all of the states teams here, if you'd like to be part of a webinar, featured on a webinar, just let me know and we'll schedule a time for you during one of our series. And the one thing that we make sure on our webinars is that we don't always have to have a completed, fully done, fully formed project. Sometimes if there are lessons learned or partnerships that you've made and it's emerging and you're still kind of doing that, those are really helpful to our network as well. So don't be shy if you feel like you haven't. If you'd like to present, send Miriam and me an email.
Yeah, we will be sending. I think Finland's going to send you guys as soon as we get the draft of the low-wage worker brief more put together. We're going to send it to you guys to review and give feedback.
Wonderful. Thank you.
Hello.
Hi, Finwa. We can hear you.
Hi. Sorry about that. I was using the computer audio and it wasn't working, so I had to call back in. So apologies for that. As Suzanne just mentioned, we will be sharing the created brief with the USBC, the Constellation. Is there a specific process in terms of requesting feedback from the constellation that we should be aware of? Should we just send it to Cheryl and ask that the constellation reviews it and gives feedback, or do we need to present it to the constellation? What would you suggest?
I'll defer to Cheryl, but that would be great if you could. Usually they have standing meetings during the month, and they could put you on the agenda and have them review. It would be great if somebody from your team would be joining that meeting, so that, you know, in addition, people could come into the meeting having reviewed, and they can there'd be more discussion during the call as well. So Cheryl can work with you with that. So would you like me to give a heads up to Cheryl? How best would it work? Would you and let her know that a brief is coming from you? Does she know already, or should I let her know?
No.
So, okay.
Yes, a heads up would be great. I'll also send an email closer to when we think the brief will be ready. But if you can just let her know that something will be coming from us, and then we can work with her to identify who will be on their call to answer any questions and receive the feedback.
That's great. I'll do that, because then as she's planning out the agenda for the next 1 or 2 meetings, we'll make sure we put a placeholder for you for any of these, you know, coming months, weeks. So excellent. I'll do that.
Great. Thank you.
Sure. Jacqueline, anything from your vantage that you'd like to share?
So we were able to connect with Charmaine Harris in Wisconsin from the Kenosha Family Resource Center. So they have a really fantastic dedicated dads program. So me and my team were able to sit down and talk with him and pick his brain a little bit on what worked and didn't work for them when they were starting out. So that was really beneficial. So now we're just working on getting the project off the ground and seeing how we can also fit other partner support materials into the state WIC website, the clinics, you know, providing posters and normalizing dads being present in the clinics, and also working on adding in resources in our overarching Nevada Breastfeeds website as well. So that's basically where we stand at this point in time.
That's great. We haven't done a webinar on fathers, dads, partners, spouses, or, you know, other family members as well. So I would love to have Nevada, other states. I know North Carolina has been doing some work with dads as well, to consider presenting maybe sometime in 2019 or early 2020. So Jacqueline, I will be in touch with your state about setting up a time when you feel you might want to share.
Okay, sounds great.
Great, thank you. Katie, did you, we didn't hear from you earlier, so thank you for joining. We have Katie. North Dakota. Okay, Katie, if your line is, if you can unmute your line, we'd love to hear from either you or Michaela about North Dakota.
Hi, this is Michaela. So some updates from North Dakota. We this year focused on offering grants to tribal communities to implement policies or practices in their community. And so they're just in the stage of kind of getting their projects off the ground and started, but 5 different awards were given out, and it'll be exciting to see when they're all complete. One site is actually doing Mother's Day photo shoots where they'll use tribal members through their WIC and tribal health programs to create community posters for breastfeeding, as well as another agencies working with their casino to create a lactation policy and space, and that's their largest employer for a lot of their moms in the community. So it's a really big win for them.
Nice.
Yeah, so it'll be really great once all of this is done and we have some information to share. And I think our biggest thing moving forward is right now there's kind of a collective or coalition forming from one of the tribal areas, but they're just new, and so in June hosting an in-person meeting. So always thinking about moving this work forward and how best to support them so that after this project, communication and work still continues.
Great. Thank you for thinking through that sustainability part of it too, that when it ends, when this project ends, there's still some way in which the support can continue. So wonderful. Again, this would be, all of your projects have been just terrific, and we want to highlight each one of you at the USBC webinar. So, you know, Miriam and I will be eager to hear from you and find a time that works for you. So no pressure, but yes, this is work that needs to be shared with the larger first food field. Thank you. Kelly, do you want to share from Wisconsin?
You shared in the chat box, Kinkini?
Oh, I just said, okay. Thank you, Kelly. Yes, so Kelly is also doing a statewide recognition program for breastfeeding friendly work sites and reaching out for more TA. Okay, perfect, Kelly. We look forward to hearing from you and supporting Samaja. Are you able to share? Did I say your name right, Samaj?
Yes. Jackie is our leader, so she summarized everything for us.
Oh, okay. And terrific. So we'll send out a follow-up email with the resource list. And if any of you want the child feeding survey questions, let us know, and we'll send it only to the folks who need it. Sandy, what do you say? I mean, I don't know. Should I be posting these questions for all as
I don't. No, I think just send them to the ones that need them. I'm not sure.
Yeah, that makes sense.
Yeah.
Okay. And well, thanks everybody. If there's any other, we have 5 minutes. If there's anything else you'd like to bring up, either to share resources or to ask for TA help, this is a good time to do that.
This is Jackie. I just to comment about how wonderful the series from WorkLife, the WorkLife Law Center was. So I'm really excited to hear that we'll have another opportunity to talk with those advocates in the future, because that's been very helpful for me and my state.
Wonderful. Yeah, they are doing amazing work. And we've had 2 or 3 states now, I think Alabama. So besides all of the work sites, we are also one of our learning communities, peer-led learning communities, as have students, which is the workplace is doing for students, but also for women in incarceration. So both for women who are in incarceration, but also the employees of county, state, and federal prison systems. So WorkLife Law has done amazing work, and Jessica Lee, who is one of the legal folks, she has specifically worked with the prison population. So if any of you in your state is doing anything with women in incarceration and support for that, let us know, and we'll share Jessica's email or join that learning community where we can have her come and be part of that call as well. So thanks everyone, and good luck with your projects, and thank you for all that you do. So we are really happy to be able to connect the dots for you, lift up the work that you do. And I think I should remind, if you haven't done the evaluations for the webinars, please do complete them because I know Sandy and the steering committee, we look at the webinars, we see what's resonating for you all and what can be brought. So the evaluations are super important. Sandy, did you have anything you wanted to share with the teams?
No, not right now. Look forward to being able to see some of you at the annual ASPHN annual meeting coming up June 9th through 11th. Each state will be presenting a poster on their work, and some of you will be here on this call. Other than that, I don't have anything.
Yeah, I think, I'm looking forward to hearing about it. That's the time that we have our board meeting, USBC. So I am bummed I'm going to be missing the ASPHN conference, but next year we'll make sure we are there. But good luck with the conferences, good luck with your posters, and just know that Miriam and I and the members of our USBC staff team are here if you need anything as you're wrapping up your projects. Thanks, everyone.
Thank you.
Thank you.
Thank you.
Thank you.